we'll get started in about 2 minutes. June, can you check if you have control on your end?
Okay. If I have control, so okay, now I do.
Perfect. All right, 12 o'clock, so let's get started. Hello, everyone. Thanks for joining us today for our webinar. My name is Patrick Chu. I'm the policy lead at ARMBC, and I'll be facilitating this webinar today. So currently, there are many ecological issues that demand societal attention, such as climate change, food safety, sustainable development, species extinction, and exposure to toxic contaminants and pollutants. Critical issues that influence the health of the natural environment impact all of the social determinants of human health in many ways. And nationally and globally, nursing is recognizing that the profession does have a role to play in improving environmental health. So the goal today is to provide you with a bit more of an understanding around nursing's role, and hopefully by the end of the webinar, you will have a better understanding around the interconnectedness of environmental and human health, how environmental health is a foundation for nursing and primary health care, and the work being done by nurses, especially within the Canadian Nurses for Health and the Environment group, which is an associate group of the Canadian Nurses Association. I'd like to introduce our two presenters, June Kaminsky and Fiona Hanley. June graduated from the University of British Columbia with a baccalaureate and master's degree in nursing, and is currently completing a PhD in curriculum studies in the UBC Department of Education. She is the current past president, treasurer, and webmaster for the Canadian Nurses for Health and the Environment, and editor-in-chief of the Canadian Journal of Nursing Informatics and the Online Journal of Nursing Informatics. June is the curriculum coordinator of the BScN program at Kwantlen Polytechnic University and has taught in the KPU nursing program since 1989. June is a research coordinator for Arthritis Research Canada with a focus on Indigenous wellness while living with arthritis. She is dedicated to guiding students, faculty, and practicing nurses in developing nursing informatics, activist, cultural, and ecological awareness, knowledge, and skills so they can serve as leaders in the shaping of national and global health for all. Fiona, who joined us from Quebec, actually completed her initial nursing training in the UK and subsequently her Master's of Nursing at the University of Montreal. She has been involved in a range of activities promoting the links between nursing and environmental health, including the integration of environmental health in her teaching of nursing and presentations at conferences in Canada, the US, and France. She has published in both the Canadian Nurse and Perspectives Infirmière on an advisory group for an online teaching module on climate and health for nurses. Fiona is a nursing faculty member at Dawson College in Montreal. She was a member of the Canadian Nurses Association Environmental Reference Group and is currently the Quebec rep for the Canadian Nurses for Health and the Environment, and she is also a board member of the Synergy Santé Environment. So we're going to have Fiona and June deliver the presentation for about 40-45 minutes, and at the end we'll allocate some time at the end for questions. And if you do want to ask a question, please do type it into the taskbar that's located on your screen. Double-click on the questions tab, and we'll read out the question at the end for June and Fiona to address. So I'll hand it over to June and Fiona.
Great. Thank you, Patrick. So welcome, everyone. We'd like to welcome you to this one-hour webinar focused on nurses and environmental health. And thank you very much for joining us, probably in the middle of your busy day. We also wish to acknowledge that this session is being held on the traditional unceded lands of the Musqueam, Tsleil-Waututh, Squamish, and all of the Coast Salish First Nations people who have been on this sacred land for thousands of years. This is what we're going to look at. This presentation has been organized into 4 sections. So what we will cover is the interconnectedness of environmental and human health, environmental health as a foundation for primary health care, an overview of the Canadian Nurses for Health and the Environment, and then leave some time for questions. So part 1 is looking at the interconnectedness of environmental and human health. So the natural environment is considered to be an important and interconnected determinant of health. Currently, many ecological issues demand societal attention, including climate change, food safety, medical waste, and other waste, and exposure to toxic contaminants and pollutants. Critical issues that influence the health of our natural environment impact all of the determinants of health in many ways. In their 2015 discussion document entitled Global Change and Public Health, Addressing the Ecological Determinants of Health, the Canadian Public Health Association presented several vital ecological determinants of health that must be considered when we discuss health. And these determinants are shown here on the screen. And they expand the usual determinants of health, including oxygen, water, food, a healthy ozone layer, nitrogen and phosphorus cycles that circulate nutrients needed for plants and thus for our own food, some systems to detoxify waste through natural processes, and abundant fertile soil, fresh water, and marine aquatic systems to grow our food and other plants, abundant energy, and a reasonably stable global climate where temperatures are conducive to all life on the planet. Urbanization is also an important factor to consider in environmental health. For the first time in human history, we now live in an urban world. Globally, the 50% mark was passed early in this century, and by 2050, it is expected that the urban population will be 67% of the total population, and that's including 86% in more developed regions and 64% in less developmental regions. And in the 2015 discussion document, the Canadian Public Health Association wrote, almost 1 billion people, 1/3 of the world's urban population, live in slums and informal settlements. These residents bear the burden of ever-widening inequalities in income within countries, inequitable distribution of wealth, and a greater burden of environmental hazards. Now, this table on the right shows some of the impacts at a global level of environmental changes. And again, the Canadian Public Health Association presented this table within their 2015 discussion document that I referred to in a couple of slides ago, and described it as Table 1 shows the estimated numbers of people globally at risk from selected major examples of the adverse health impacts of global environmental changes. From this, it is apparent that there are many impacts stemming from a variety of causes, and that the numbers of people at risk is very large, ranging from hundreds of millions into the billions of people.
Hello, everybody. This is Fiona here. So we've talked about a little bit about the impact on humans, and so we also need to talk about the human impact on the environment itself too. So we know that for around about 12,000 years, the Earth has experienced a temperate and stable period that is called the Holocene, and this period has allowed humans to expand and to flourish. However, there is increasing agreement that this title or this nomenclature does no longer reflect the times that we live in, because humans have so drastically altered the physical structures and functioning of the planet that Anthropocene, or Age of Man, is seemingly a much more fitting title for this epoch. If you have a chance to look at some of the extraordinary NASA photographs of the world at night, we can see how it glitters thanks to our love affair with fossil fuels, the fossil fuels that have driven economic development and given us the power both to transform our lives and also to transform the world. So we have failed really to grasp the radical changes that have happened planetary-wide, and even not to really notice the consequences of, some say, it's a huge out-of-control experiment, so that we've altered not only the geological structures and patterns on land and water, but also the atmospheric, cryospheric ecosystems and overall global functioning. So despite the huge advantages that have been brought to human health and well-being, we have also increased our capacity to put at stake the gains that we have made over the last couple of centuries. So the result is the age we have made, the Anthropocene, the consequences are pollution of our air, water, soils, chemical pollution, etc. You can read the list here: radioactive pollution, population explosion, and other major impacts on our global environment. And also we can talk about the loss of our connection to nature, to our sense of belonging, and the loss of security and a sense of place that has resulted from all these massive impacts that have occurred across the planet. So if we look, for example, at air and water, which we have long understood as essential to life and health, even in the time of Hippocrates, and very foundational as well to Nightingale's thinking of contributing to health and illness. So we know that Canada, for example, is a country largely defined by water and very rich and pristine lakes and rivers, but we are not always conscious that our water and air are in jeopardy, that lakes and rivers have been repositories for industrial and agricultural runoff. They absorb pollutants and toxic chemicals from the air and soil, both in urban and rural areas. Acid rain has damaged our water basins, our forests, soils, and wildlife populations, as well as our infrastructures. So air and water quality both are in jeopardy, with acid rain, smoke, fine particle contamination, ozone layer depletion, climate change, and acidification of oceans. And of course, one of the consequences of the higher levels that we are experiencing of CO2, which is now over 400 parts per billion, is the acidification of oceans, with significant consequences in species composition, disruption of marine food webs and ecosystems, and jeopardizing also the marine-based diets of people on a global scale. And these changes are occurring at a much faster rate and at a greater scale, actually, than we had imagined. And so just as it has similarly occurred on land, we have also profoundly decreased the abundance of both large and small marine fauna. Air quality, just to say quickly as well too, that already 10 years ago, some of you might be familiar with the report from the Canadian Medical Association called No Breathing Room, with a portrait of the alarming health consequences they saw, even then resulting from air pollution. And so we know that these costs are staggering in human terms in rates of premature death and multiple comorbidities. And of course, huge implications for economic costs associated with these. And there's been much work on protecting Canadians from the effects of poor air quality, including a Train the Trainer program on the Air Quality Health Index to guide particularly vulnerable or active people in activities related to air pollution. I also might just quickly mention about the issues related to indoor air quality as well, since most people spend most of their time indoors, and so the air quality inside can also be very poor, particularly with poor ventilation, like often occurs in the winter, and exposures to chemical products, synthetics, nitrous oxide, carbon monoxide, and mold, for example. So there's still a lot of work to be done in sensitizing people in avoiding exposures in the home or the workplace or other indoor areas, and finding alternatives to improve the air quality indoors. In terms of climate change, of course, climate change essentially makes everything else worse. It aggravates the health problems and creates new disease patterns. So we're seeing new emerging diseases, vector-borne diseases. So, for example, we're seeing here in Quebec very important increases in Lyme and West Nile virus as the insect territories increase. Those who suffer already from allergies and asthma are more exposed to the increase in pollen. The water and foodborne diseases are more prevalent as well. Mental stress increasing as well too in relation to loss of homes, flooding. We had major floods in Quebec this year. And also landslides would have occurred as well too, especially along water bodies, all linked to climate change as well too. So the Lancet in 2015, their report, which they brought out, they really emphasized the idea that there are opportunities for public health that arise with action on climate change. And so that hence the quote there saying it's the biggest public health opportunity of the 21st century, because we know that every action that's taken on climate will also bring co-benefits to human health. Those of you might be familiar with the Living Planet Index, and so the latest index that was published in 2016, the report shows that there's a subset, a very important subset of populations of species that have declined by alarmingly by 58% between the years 1970 and 2012. And although the trends are different in different systems, so we've mentioned about earth systems declining, and also marine systems have also declined at really quite similar rates. And freshwater is reduced to freshwater species are reduced to less than a quarter of their abundance in 1917. So very important markers of changes occurring in the natural world as well too. When we talk about environmental health and climate change, we have to consider vulnerable populations, and the Canadian Nursing Association has very clearly linked these issues with social justice issues, because we know that it is often the people who have least contributed to these changes or to these effects on climate or on the environment that are often the ones who have suffered the most. So the elderly, the chronically sick, pregnant women are at particular risk, as of course are children, people in Indigenous First Nations communities, both in urban and in remote communities. But we also know that outdoor workers are often at very high risk, for example, in relation to heat and other exposures outside to chemical exposures, for example. Poverty, we know, is a huge factor in contributing to increased vulnerability. And we also know that immigrants, migrants, are at particular risk, as are communities of color, even here in Canada as well too. So, the next slide, we wanted to show you this Canadian Environmental Health Atlas, which can be a very useful online resource that you can become familiar with. And the aim of the Atlas really is to raise awareness of the many, many different ways that environmental influences affect human health, so that and how we might look at some of the interventions that we can make in protecting health, but also increasing our understanding of some of these many different factors in the contribution of health and public health in particular. So if you, afterwards, you can look and see this health atlas and click on, you can search by subject, by disease, by type of contaminant, etc. And you can find it's a very rich and comprehensive picture of environmental health in Canada.
Okay, now we're going to switch to look at the role of nurses in environmental health. The environment is an important determinant of health, as we've mentioned, and has a profound impact on why some people are healthy and others are not. The Canadian Nurses Association believes that the public expects nurses to be aware of and to know how to promote Canadians' health in the context of environmental health issues. In their updated Nurses and Environmental Health Position Statement, this was just updated this year, the CNA outlined the role of nurses in environmental health, which included assessing and communicating risks of environmental hazards to individuals, families, and communities, advocating for policies that protect health by preventing exposure to these hazards and promoting sustainability, producing nursing science, including interdisciplinary research related to environmental health issues, and educating patients, families, and communities about environmental health and how to address the key issues from that, showing leadership in personal practice that support and reduce harm to the environment, and that can be done in so many different ways, collaborating with interdisciplinary colleagues to identify and mitigate environmental health risks in practice environments, and promoting the development of natural and built environments that support health. A great quote that was also from this position statement states that understanding and applying environmental health principles should be a part of every nurse's practice, and we emphasize every nurse's. CNA values the work that nurse leaders, educators, and students are doing to integrate and bolster nursing knowledge and skills related to environmental health. And the CNA advocate for the further inclusion of concepts that support eco-literacy in basic and continuing nursing education, strengthened when necessary, and taught in both academic and workplace settings. Rather than being taught as a specialized area of practice, they suggest that environmental health can be integrated and should be integrated into all areas of nursing practice. So it should be seen as an integral part of everything we do as nurses. Now, this is another amazing resource available on the Canadian Nurses Association site. It's their Nursing Environmental Health portal, and it offers several key resources that you can explore. These include 3-minute videos that feature different nurses from across Canada and focused on health, environment, and nursing. Another one's the role of nurses in greening the health system, and then there's one on nurses and climate change. There's also some backgrounders on the ecosystem, natural environment, and health and nursing. There's one on environmental health and an introduction for nurses, and then the role of nurses in greening the health system and the role of nurses in addressing climate change. And then this is where you can see the updated position statements. 2 of them have been updated this year. One is climate change and health, and nurses in environmental health. And then there's another one called Toward an Environmental Responsible Canada Health Sector that was done collaboratively with other groups. And then there's a couple of other publications available and some education modules.
So we're at part 2, our second part now, environmental health as a foundation for primary health care. So we just wanted to say a few words about primary health care, which, as it says here, includes all services that play a part in health, including income, housing, education, and environment. So when we're thinking about primary health care, we're thinking about health wherever people are. So we talk about where people live, where they play, where they worship, where they work, etc. too. and primary care being the element that within primary healthcare that really focuses on healthcare services, including health promotion, illness and injury prevention, and the diagnosis and treatment of illness and injury. Primary care, however, has not typically included aspects of environmental health and has a tendency to focus on lifestyle, often ignoring outside factors in the environment that include health and illness. And the focus often is on the downstream rather than the upstream social, cultural, and economic influences on health. So that although that in principle the approach means being attentive to and addressing the many factors in the social, economic, and physical environments that can affect health, and that are emphasized here, as you see by the Canadian Nursing Association summary of the issues in relation to primary health care from 2005 already, it often in practice is not recognized in that way too. Some of you might be familiar with some of the work of Dr. Trevor Hancock from the University of Victoria and editor of the Canadian Journal of Public Health, who has really argued on the importance of, he was one of the authors of the Ecological Determinants of Health report that June had mentioned earlier on, and really argues for taking an eco-social approach in population health promotion to recognize the interactions between ecological and social determinants of health and the profound implications for the practice of public health that could occur with that. We also know that prevention and health promotion has a very small part in our healthcare budget, and recent numbers have shown that budget for prevention is estimated to be in BC something like 5.5%, and shamefully Quebec is even less at less than 2%, example well too. So one of the ways that the Canadian Nursing Association has mentioned that nurses can strengthen their practice is in considering questions, for example, like what are the effects of social, economic, and environmental factors on the health of your clients or your patients? And are we thinking about some of those factors when we're developing our nursing assessments and our interventions with our patients or our clients? And we will certainly provide some tools for some assessment tools that are being developed in terms of how to phrase some of those questions and what some of the questions are that we can ask. The core values of primary healthcare were, it's worth reminding ourselves really of some of these core values that were developed in 1978. But perhaps nowadays with planetary health as a foundational context for all of these, since we understand so much more about some of the planetary changes that have occurred since the Alma Ata Declaration of 1978. The other important element to consider, of course, is the health sector responsibility. And there was a joint position statement that was created in 2009 between the Canadian Nursing Association, the Canadian Public Health Association, and a whole list of other groups, where there was the creation of a call to action really for governments and policymakers at all levels to understand and address links between health and the environment, and therefore to incorporate these links into policy decisions through legislative and budgetary actions. There was a very strong call for all healthcare organizations to really make the pledge to be conscious of and to decrease the impact that their activity has on the environment and seek solutions to the barriers that currently exist. We might mention that the healthcare system, of course, is a huge industry in Canada, and it uses vast amounts of resources. It's a very significant contributor to environmental problems of air quality, waste, like we previously mentioned, chemical exposures, etc. Dioxins and furans being some of the important air pollutants that come from incineration in our healthcare systems as well too. So we really, the Canadian Nursing Association has been very outspoken in calling for all individuals working in the healthcare sector to both to model and to advocate for environmentally responsible approaches in delivering healthcare, at the same time not compromising patient safety or care. And we certainly believe that nurses can have a very important impact, and that nurses are very particularly qualified to bring information to the public on protection from environmental sources. We know that nurses have assessment skills, they have the scientific background, they have education in understanding human experiences, and they also are have, with the knowledge that they have, to be able to identify the potential to identify hazards and communicate to the public, like we have the ability often to be able to communicate complicated issues to our clients and to our patients, to explain exposures, how to reduce the risk, and help enable our patients to be able to change their exposures. We know that nurses are, there is a role for every nurse to promote and support actions to optimize the health of the environment in relation to links to human health. And I would also add that nurses are really key in recognizing the importance of health environments, or the links between nature and the assessments of ourselves as humans. That we, when nurses speak out, for example, on the right to a healthy environment, then people can listen.
Okay, so now we will move on to part 3, which is giving an overview of the Canadian Nurses for Health and the Environment. And the Canadian Nurses for Health and the Environment represents registered nurses dedicated to the improvement of environmental health across all domains of nursing practice, policy, research, and education. And we are a member of the Canadian Network of Nursing Specialties of the Canadian Nurses Association, and we work to facilitate knowledge sharing and transfer based on environmental health principles and nursing best practices. These are the objectives of the group. So we work to achieve facilitating knowledge sharing and transfer based on environmental health principles and nursing best practices, support evidence-based environmental health practice, influence policy development and legislation to support environmental nursing practice, and promote educational and research opportunities for nurses. We do have a website, and you can see the link at the bottom of this blue section of the screen. Things that we currently offer is our blog and social media, partnerships with other groups across Canada that are promoting eco-literacy and environmental concerns, advocacy and issues, environmental action alerts, research and education support, updates from the Canadian Nurses Association. And we are thinking about having a national conference, and we do encourage people to attend the biennium for the CNA, and we're usually quite involved in that. We have upcoming events, usually action-oriented or educational. We provide recommended links that will support your research in environmental issues. And then we also have a private members portal and mailing list.
So we are really hoping that people might be interested in joining with us, and anyone who feels that they would like to join with us, we really are calling on people to join with us, as we certainly need the expertise of nurses around the country. And the experience of nurses in understanding local issues, in acting on in a way that we can help to create a healthier, safer ecosystem. So we were this is our call for action here. We really are hoping that we can increase our membership. We are calling also on students. Students, of course, are the future of the profession, and the students are the ones that we know. The young students are going to be the ones who are seeing even more rapid changes in terms of ecosystem changes. And so we do have free membership for any nursing student enrolled in an approved or accredited undergraduate nursing program in Canada. They are eligible for individual membership in CANE-ACIIE, and it's very easy to complete the registration form and join us. We are also calling on nursing educators, of course. We would like to invite all nursing faculty and nursing instructors who know how important it is to include environmental health and eco-literacy into the nursing curriculum. And we know that many people are doing so across the country. Many people are often doing this quite quietly. So we certainly would encourage them to think about joining us now and adding your voice to our environmental learning resources, which we are developing for nurses. And again, the Canadian Nursing Association position statement has really emphasized the importance of eco-literacy in nursing education. So not just a graduate level, but certainly very much at a basic level and continuing education to help to enable nurses to consider factors in the environment that might be contributing to poor health, to be able to have at least a basic understanding of environmental hazards and their impact on health, to help us understand the role of individuals and communities in providing good stewardship of the environment and make recommendations. And of course, to conduct research on environmental health issues. We certainly need to have more research on environmental health. So we are preparing curriculum resources and learning activities at the moment that can be used by schools of nursing to integrate environmental and eco-literacy content and theory into nursing curriculum. And I know June and I, both being educators, have certainly had the experience of doing so and finding ways to weave this into our teaching. So we want to be able to have more of these resources so that nurses can develop their own personal eco-literacy. And so this is some of the preparatory work that we're doing at the moment. So the environmental scan is to try and help us find what people are doing, because as I said, we sometimes don't know about all the work that nurses are doing across the country, and so we are trying to have a better feel of what kind of information is out there, what people are doing, what resources they're using, and what kind of learning activities are being developed, so that we can all share these and enable other people to be able to use these activities as well. So we are also undertaking a literature and resource scan at the moment as well too, to be able to find more of the tools that have been developed, so that we can have a resource collection in order to be able to distribute to nurses across the country.
So some of our initial curriculum topics are listed here, and I'm sure there'll be others that we'll need to tap into. But ones we want to begin with are focused on how nurses can promote air quality, water quality, food quality, address climate change, environmental contaminants, pollution, and ecotoxicity, how to address resource depletion, biodiversity, and species extinction, and then also to raise concerns about radiation exposure, healthcare waste, and promote green healthcare systems, and fundamentally promote eco-literacy in all nurses and nursing students. One of the key ways, and to us the most logical source of sustainability wisdom to support this type of endeavor, and it promotes ecological wholeness, are traditional Indigenous teachings and philosophies, and these will be integrated as well within the learning activities. Nursing educational programs are beginning to incorporate Indigenous wisdom into curriculum to help evolve ecoliteracy and holistic care, and these tenets are also being included, as I said, in this environmental planned curriculum. So some of the fundamental teachings include what could be summarized as the 7 generations, which is a wide-angle lens that's needed for ecoliteracy. This is an Indigenous approach and to view all actions from the vantage of 7 generations, the 7 to come and the 7 who have passed, and to think about what we do ripples through time and should be built on the good from the past to ensure the future for the upcoming generations. Also, all my relations and interconnection. First Nations relationships fully embrace the notion that people and their families are strongly connected to the communities they live in. They're connected to their ancestors, and they're connected to their future descendants. They are also connected to the land they live on and all of the plant, animal, and other creatures that live upon it, upon the earth. A deep respect and protective caring is needed to stop species extinction and improve the quality of life for all. So this sort of approach helps to support this. Another approach is 4 directions in holistic balance, where the 4 directions represent the growth and developmental stages, such as child, youth, adult, and elder. The 4 seasons of life, the 4 directions, north, west, south, and east, and the body, mind, heart, spirit, quaternity, which we all need balance in our minds, bodies, emotions, and spirits for holistic balance. So those also will be included. Another approach is called the 4 pillars of learning, and those 4 pillars are respect, relevance, reciprocity, and responsibility. Respect, meaning respecting all who live on this planet. Relevance means developing a relationship with nature that has personal meaning. Reciprocity is creating a dance-like reciprocity with all living things, so we do not impinge on the well-being of other species, etc. And responsibility, becoming stewards for the earth and the 7 generations, both past and future. As well, a connection to place is looking at, we need to understand our place in the web of life. We can start by developing a deep connection to the place where we live, where we play, and where we work. A sense of place emerges through knowledge of the history, geography, and geology of an area, knowledge about its flora and its fauna, the legends of the place, and a growing sense of the land and its history after living there for a time. As well, we will embrace the notion of being stewards of the land. For countless generations, the First Nations people have had unique, respectful, and sacred ties to the land that sustained them. They do not claim ownership of the earth, but rather declare a sense of stewardship towards the land and all of its creatures. And traditionally, First Nations people see their relationship with each other and with the earth as an interconnected web of life, which manifests as a complex ecosystem of relationships. Another notion is to walk softly on the earth, and we all need to ask ourselves, what is my ecological footprint? And this goes far beyond the notion of a carbon footprint to urging us to ask ourselves, how do I tread on this earth? And what is my impact on the health of the environment? So going not just from a professional level, but a very personal level. Another way that we feel it works well to teach this sort of curriculum and that we would incorporate in learning activities for educators to use is to encourage learning together and learning experientially. So nursing students could learn by experiencing through theory work, group work, practical work, and experience working with others, and then experience also working with elders and Indigenous communities. By reflecting on their experiences, students make meaning of what they've learned and take action to apply their learning to their nursing care of clients. So opportunities to work together with Indigenous communities, including leaders and elders, would support their learning and connecting with the earth in an experiential way. And then finally, raising our voices together in collective activism. Nursing students need to learn how Indigenous nations are often at the forefront of activist movements to protect the land, water, and air. And an example right now is the Kinder Morgan. There's a lot of First Nations banding together to help support to stop the Kinder Morgan expansion in British Columbia. Also, the fish farms are another very out front kind of activism that's happening right now on the West Coast. Protection of the oceans, lakes, rivers, and aquifers are also of high concern to many Aboriginal communities. So we wholeheartedly invite you all to join the CANE-ACIIE. We invite nurse educators to join us and become formal members of our working group to help develop this curriculum. We also encourage all nurses to add their voice to the mandate and focus of the CANE-ACIIE and become members, and likewise to add their voice when we address CNA, etc. At each AGM and biennium, we often bring forward resolutions, different aspects to protect the environment. As well, we really encourage undergraduate nursing students and graduate ones as well. The undergraduate ones can join for free. And then we also want to encourage you to let you know that members are part of a committed group dedicated to taking a stand on environmental health issues that threaten the health and well-being of Canadians and the planet as a whole. So we've also included on this slide just a handful of resources to help get you started. And we will also make a more complete handout and give it to Patrick to conclude with a recording of this so that you can download it. But these are just some really great ones to get you started. And if you would like to contact either Fiona and I, our emails are included on this slide and with a little bit of a blurb about us again. And now we'll go to part 4, which is opening up for any questions you might have.
Great, thanks so much, June and Fiona, for that great presentation. For those who joined us late, if you have any questions that you want to ask June or Fiona, feel free to type that to the task that's located on your screen. Just give maybe a minute or two for anyone who has a question to type it in. One of the questions is just regarding when the participant can watch and listen to this webinar again. It will be posted on the ARNBC website by the end of this week. So go back to the ARNBC website and check. It's going to be posted under the archived webinars where the rest of the webinars are housed. Another question is, are there any nursing positions in Canada available for nurses to work directly in environmental health?
Well, this is Fiona to respond to that. I think it's a question of there are no official positions as such. But I think that, and I think I can speak for both June and myself, that it's a question of taking opportunities really, and not necessarily having the label of environmental nurse or eco-nurse, but really in beginning to think about ways that one can start to integrate some of this in one's practice. So for example, depending on where you might be working, if you're working with in maternal child health, for example, there are many opportunities for not only making an assessment of what some of the potential exposures are with mums-to-be or young families, but also in being able to give very solid advice on what kind of exposures that you can help them to avoid. So whether it's something as simple as cleaning products, having an analysis of what are some of the products they use to clean their houses with. People are very eager to know those kind of things, and that we know that they can make a difference in reducing the body burden. Sometimes a bit more obvious, sometimes in community health, where you are going into people's homes, but there's also many opportunities in hospital practice as well for different kinds of educational opportunities. Working with the elderly, for example, there's a special vulnerability with the elderly or those with chronic diseases in relation to heat, for example, especially in relation to certain medications, cardiovascular medications, for example, which make them more vulnerable to heat exposures. So those are other ways that one can think about the environmental exposures or aspects of climate change. Being conscious of things like Lyme disease and West Nile virus, etc., being aware of what those kind of health impacts are, what they look like, when people come with symptoms, being able to have an idea of what these possible connections can be. I don't know if you would like to add, June.
I totally agree with everything you said, and I also would encourage nurses to become involved in different campaigns, policy, when they put out a call for people to add their voice to different policies that relate to environment, etc. Because the nurses are such a respected group that adding our voice to any of these initiatives would improve the validity and reliability and credibility of a campaign.
Great, thanks, and thanks for that question. The next question is, how are CANE-ACIIE groups organized in various communities, and what key issues are they working on?
Well, actually, we're a national group, so we represent nurses from across all provinces and territories. And the key issues we are working on right now are, one, the curriculum that we've suggested and that we've described. Two, also, to initiate awareness. For instance, two of our recent campaigns, and we did exposés on them and a webinar on them, with the various tar sands and pipeline issues across. There's so many different ones. Primarily right now, the Keystone and the Kinder Morgan ones are big initiatives. The Enbridge one was squelched here on the West Coast because of a lot of different First Nations and other environmental groups getting together and appealing to the Prime Minister, etc. Another one is mining, particularly a focus that we took and within the recent years was on the Ajax mine that was being proposed for the Kootenays in British Columbia, and trying to draw attention to the health risks of that. But we're also joining with other groups, quite a number of groups. So if you visit our website, you can see partnerships that we're forming, etc. We're looking at it as from a national perspective, and if you're a collective of nurses or other health professionals, your voice is more credible and your approach is more credible. Although there is talk now within our group of perhaps organizing some provincial groups, and I know our current president is looking at organizing one in Manitoba. So if there is, across the provinces, if there is interest in forming provincial groups, we could look at that as well. I don't know if you want to add anything to that, Fiona.
Well, I think it's like you said. I mean, ideally, it would be wonderful if we could have small provincial groups, but at the moment that has not been possible. However, I think many of our members are acting on local initiatives. In Ontario, for example, nurses were very involved in the pesticide ban that happened, working with the Canadian Association of Physicians for the Environment, and getting a very sturdy ban on the use of pesticides for personal use. They also contributed here in Quebec as well to a similar ban that happened earlier than that. There are also, it's often, we have a connection with the Canadian Coalition for Green Health, and many of our members are involved in some of the initiatives related with that, the Canadian Coalition of Green Health. Here in Quebec, we have Synergie Santé Environnement that I am involved with as well too, where I think it's important for us to be representative in those kind of organizations, because we can bring our nursing voice to it in a different way than other people that are involved in some of those organizations, whether it be people like engineers or physicians or other professionals or technicians, that it's important to bring the perspective of nursing into the conversation. Sometimes in your organization as well too, if you don't have a green committee, you might be able to help form one, or find if there is a green committee that whether there's a possibility for joining it as a nurse, because you often have a very different experience and perspective, and even if you feel like you don't have a huge amount of knowledge of environmental health, you don't have to be an expert to start off. There's so many different possibilities that you can bring, and your perspective is something very important.
And the next two questions are just around membership with CANE-ACIIE. To mention that it is free for students to join. The question is it free for everyone else who are not students to be involved? And can new graduates join the CNA Environmental Reference Group?
Well, for the first part, our fees are quite reasonable. For registered nurses, it's $35 a year. For retired nurses, it's $15 a year. And then we do have some group memberships. And again, it's if you go to our website and click on the members tab, you'll get all the information there. And the environmental reference group, I'm not clear on that question.
I think I can answer that maybe too, because I think that the Environmental Reference Group really was a project of the Canadian Nursing Association as a part of its centennial year. So their big focus in that year was on environmental health. And they had done a survey across the country of nurses to find out what kind of things they would like to have to help them be able to integrate notions of environmental health into their practice, wherever their practice might be. And as a result of that survey, then they decided to take those three topics that June had mentioned earlier on and create tools for nurses to use wherever they were. They're free. You can download them all, the PowerPoints, position papers, background papers, videos. But the project really went for about a year and a half. It was fun, and it came to an end after that time. So although the Canadian Nursing Association has, for example, like June had mentioned, it's renewed the position statements, but there isn't the project as such doesn't go on, and that CANE-ACIIE, our group, was the sequence of that. Really, those who were involved in that became the Canadian Nurses for Health and the Environment subsequently as well too, to try and continue some of the work that the CNA had done with that reference group.
And I think we have time for maybe one or two more questions. So the second last one is around whether CANE-ACIIE will be holding any type of conference specifically related to the impacts of climate change on health in the near future.
At this time, it's in very early discussions, so we have not set a date or a year, etc. But we would be interested, and I know that we haven't held that many conferences. The last one we did hold, we held it with the Aboriginal Nurses Group, which is now the Indigenous one, and Men in Nursing Group. So you probably, if we were going to have a conference, we would try to join with some other partners and do it together. The last one was held in Toronto.
Thanks, June. And the last question, can you speak to the trainer program regarding air quality that was mentioned in your presentation?
Yes. There is a trainer project that is still ongoing. that was done through the Canadian, I have to think of, it was through the, I'm just trying to think about the university that it was through. I don't remember the exact link, but I can certainly find the information and provide that information too, because it's a very rigorous training, train the trainer to understand about the air quality health index. It's a tool that looks at analyzing what the air quality is on particular days, and then depending on the number that's there, helping to advise our patients or our clients on what kind of activity that they should do based on the air quality of that particular day. I'm sorry, I don't have the exact title, but I can certainly get that very easily.
We can add it to our handout. Yeah.
Sure. I mean, the problem here is in Quebec, for example, although we had it in Quebec, Quebec doesn't follow the Air Quality Health Index, and so that's a little bit rusty in terms of the exact information about it.
Great. Well, thank you so much for all of your questions. That concludes our webinar for today, and I'd like to thank June and Fiona for all of your work for developing this webinar and delivering it. Like June and Fiona mentioned, if you have any questions for them as well as CANE-ACIIE, their contact information will be on the slides, and the recording and the PDF will be posted on the AirNBC website along with a comprehensive reference list. So please do go back and check up on that. And also check back on the AirNBC website for any webinars that we'll be delivering in the near future. And please feel free to email us if you have any further questions or concerns. So thank you so much, everyone, and we'll see you next time.
Great. Thank you, Patrick.
Thank you very much, Patrick. Thank you, June.
Okay. Thanks, Fiona. Bye.
Thank you, everybody. Bye-bye.